Okay, James, this is our evaluation protocol. We're going to start off listening to your craniosacral rhythm. I'm going to start with the heels. And what we're feeling for here is the craniosacral rhythm. It's going to move in external rotation when it's in flexion or filling with fluid. It's going to move in internal rotation or extension when the volume of fluid is lessening. So right here, your rhythm feels pretty good. You have a good flexion or external rotation, and now extension or internal rotation. So we've got a sense of that. We're going to move up to the next listening station, which is the dorsums. I'm going to feel for your craniosacral rhythm there. When I feel the rhythm here, it changes, and it can change when we cross a joint. When I get onto the dorsums, I feel the craniosacral rhythm out of synchrony. As the left foot goes into flexion, the right foot goes into extension. So we're going to note that, noting that something happened in one of the ankles or both that created this dysynchrony. Do you have any old ankle injury, stress or strain that you remember?
Yes.
Okay, which ankle was it?
Actually, both at certain times.
Both. So,
strains and sprains from soccer injuries.
Okay, so that can create that imbalance in your craniosacral rhythm there. Let's move up above the knees now and see if that continues, and it does not. When we come above the knees, we have extension, internal rotation, flexion, external rotation. The right leg does not move as well as the left in flexion, so we'll note that. And move up to the hips. We're going to get right on the ASISs, or anterior superior iliac spines, and that's extension and now flexion. And we have the same difficulty here. The right side will not go into flexion very well. There's less flexion on the right, continuing that restriction we felt in the thigh, and possibly even in the ankles. We'll move up to the ribs, just the lower part of the rib cage. Extension feels good. Flexion feels good. So it looks like that right-sided restriction is from the hip down through the leg and into the ankle. So we'll want to work with that later in the treatment. Let's move up to the shoulders. The shoulders, flexion is very restricted on the right. Extension is very restricted on the left. So it appears that everything is shoved over toward the left side. It's a technical term for shear, lateral shear. So we'll note that and move up. I'll sit at the head of the table and I'll check the shoulders from here too. Give me a slightly different hand position, see if we feel the same thing. And we're getting a filling, but everything seems to shift over toward the left. And already the body's trying to have me work here, pulling my hands in, especially on the left. So we're just going to note that the body wanted to be worked right here at the left shoulder. It pulled me in a different way than it did anywhere else. Let's move up to the head and complete the evaluation. We're going to start with our hands anterior and posterior on the frontal bone and the occiput to begin with, and monitor flexion and extension. Now these are singular bones. They move away from each other in flexion and toward the feet. In extension, they move back together and toward the top of the head. So this slight rotational movement. And I'm feeling a good craniosacral rhythm here, although the amplitude could be bigger. It's fairly balanced. On the lateral hand position, you want to get your hands on as many cranial bones as possible, and then monitor the cranial rhythm. It feels like the head is a big balloon. It's filling with fluid, so the volume is getting greater, and then emptying, the volume is getting less. So here we go. It's filling, volume of fluid is getting greater, hands are moving apart, emptying, The left side has difficulty emptying fluid. So there's a drainage, some sort of drainage or reabsorption difficulty on the left side. We'll note these restrictions that we found. We can compare them to the symptoms that the body's having, and then we can begin treatment. Okay, so this is what we found with James. We found that the craniosacral rhythm at the heels was okay. When we moved on to the dorsums, however, we found that they were out of synchrony. So when the left dorsum went into external rotation, the right went into internal rotation. This creates a dysynchrony and indicates that there's some sort of restriction in the ankles. So then we crossed the knees, we came up to the thighs, and what we found was that they went into extension okay, but when the right one tried to go into flexion, it couldn't go into flexion. So it's staying in extension, not able to come out into flexion. When we moved up to the hips, we found the same thing to be true with the ASISs or hip bones. The hip was stuck in extension. It does not move into flexion very well. This is continuous throughout the leg and hip. When we come up to the rib cage in here, we found that this was moving okay at the ribs. So we know that the restriction is from the hip down through the leg. We moved up to the shoulders. From the shoulders, we found that everything was shearing toward the left. And when I stayed here at the head of the shoulders, at the top of the shoulders, I felt my hand being dragged into this area, into the shoulder girdle. So we're going to want to go ahead and investigate that when we do our treatment. In the cranium, when we did the AP hand position, we felt the rhythm was good. Amplitude could be better. When we came onto the lateral position, we found a left-sided restriction. Doesn't move as well on the left side. So it looks like that we have a lot of right-sided restriction in this body, and it's creating this shearing sensation over toward the left and a lot of dysynchrony in the body, especially in the legs and then up in the shoulders. And we're okay, sort of okay in the middle and for much of the head.